วัสดีค่ะ
สวัสดีค่ะ
สวัสดีค่ะ Good afternoon and welcome back to Health Dialogue by BDMS. We are here today with the topic, a guide to manage your medicine for expat with chronic illnesses. Well, I have to say, actually, this topic is very important for everyone. And also, maybe you also can help and assist your loved one who has the diseases and has to manage about medication. And let me welcome our clinical pharmacist. The first one here is pharmacist Keeratikan or Kun Enfa. And the next one, clinical pharmacist Sineenat or Kun Eun. So both of them will be with us and give you more information about how to manage your medicine at home. Or I think maybe I have to give them the chance. I'm Ying, so work as an MC, but I'm also one of their customer and I will listen to them carefully too.
All right.
Okay. So let's start.
Okay, so let's start with the disease first. I would focus on NCD. NCD or non-communicable disease. It is the chronic disease which tend to be in the long duration of the disease. And it is the result of the combination from genetics, physiological, and also behavioral factors. The behavioral factors that I focus on is smoking, alcohol consumption, and also the food that we're taking every day.
Oh, I understand that is from our behavior, but
Yes.
also from genetic.
Genetic, that's right.
Okay.
That's
Okay.
right. And the main parts of NCD, including to cardiovascular disease, cancer, chronic respiratory disease, or COPD. COPD stands for chronic chronic obstructive pulmonary disease, which is about the lung disease, asthma, and the last part is diabetes.
Almost in every part.
And diabetes. Okay. So from the research of last year, it said that over 18 of million people dies from cardiovascular disease, which is one of the NCD. That's why we focus on NCD very much.
So vascular that develop from hypertension.
It could be
patient?
developed from hypertension.
Also,
and
okay.
Yes, of course.
Oh, that's why they said hypertension is like a silent killer. If
That's
we don't
right.
take good care, we have like a bomb in our body.
Certainly.
Okay.
So for example, that I already said for the disease. Yes, of course, that four part. And that four parts of the disease cover about 80% of the premature NCD, which means that there is the other disease that we didn't focus on too. Not only these.
More than what we're talking about, but these four are the biggest group that we forgot.
Of course.
So once when we have this chronic disease, you said we have it for a long time. How do you mean long time? I mean, if I have hypertension for over 1 year, is that I'm having the chronic disease, or how long you mean?
The duration that I mentioned too is lifelong. Life is the lifelong disease. That's why we will focus on the next part of the how to manage your medicine is the compliance. The compliance is how you comply to the medicine, how you comply to the prescription, like you take the medicine regularly every day, such that. So because of the non-compliance could be the big major effect that leading to the poor treatment outcome.
Compliant mean, for example, I am a patient who has kind of disease. I went to see the doctor regularly every 3 months, every 6 months. Doctor prescribed medication for me, and I have to take once a day, for example. But I sometimes take it, sometimes forgot, sometimes wake up late. That means I'm not.
That means non-compliance.
Non-compliance.
I would
So
say that.
even I take some time when I.
You have to take it every day. That can call comply. Okay.
Okay.
And the non-compliance, I will give you an example. Okay. For the hypertension or the hypertensive patient, the non-compliance means that it's poorly control of the blood pressure, and the non-compliance could be directly associated the poor treatment outcome, and it could be the risk of the other disease like stroke or the myocardial infarction or the heart disease. That is the why the non-compliance is the very important that you need to focus on.
I know someone who think if they don't take medication someday, they can save some money and help and assist their family economy. So
Uh-huh.
that's not a good idea
That's not a
Right.
good
because
idea.
it may cost you more because you have
Yes.
to pay more. Maybe you need to go when the condition getting worse. You have to see the doctor more often, and also
Yes.
you have to take a higher dose
That's right.
or more different kind of medicine, and
Yes.
maybe you have to be admitted. Okay,
Right.
so compliant.
Compliance
Get
is
back to
very
that word.
important.
Be a
Get back
good
to
one.
that. Yes, of course.
Yeah, and next, I will going to talk about like the most very popular questions in our hospital, which is about the seasonal vaccines. Due to
Ah,
this is in the rainy season, right? It
ah,
will have the disease that come in the rainy season. For example, of the influenza viral infections or respiratory disease, or we call in the term of pneumonia or the dengue viral infections.
oh, all famous
Yeah, it's all
name.
famous in
Let
the
me
rainy
ask you,
season.
when should we focus on the seasonal one? You said rainy season. In tourist business, they may start from May onward. And how about on your site? When is seasonal
Actually,
vaccine, the new version, will come?
actually, your our seasonal vaccine will comes every year. If
Mm-hmm.
it's nearly in the November or in the December, the new
Mm.
strain will come already.
Ah,
So you can be sure that if you get the vaccine from our hospital, it is the new one for you.
yeah, the updated one.
Yeah,
Yes.
it's the
Yes.
update one.
Okay.
So, like for how to prevent the seasonal disease, we have the vaccine to prevent it. The first vaccine that I'm gonna talk today is about the influenza vaccines.
Mm-hmm.
This vaccine is a vaccine for like the for prevent against influenza viral infections. It is indicated to the person who age about like the 6 months and older. The how to inject this one, it will inject one dose every year, except for the person is like a really shy, very children, a little bit young, about like 6 months to 9 years. They need to inject about two doses by inject about the 1 month apart. But you no need to worry. The doctor will assess for you again that you need like a two dose or one dose is
I
enough.
don't worry about the children because normally their parents will take good care, bring them to the hospital regularly as per schedule by
Yes.
doctor or doctor suggest. But adult,
Adult.
Adult, right?
yes, when no one control, they may not pay attention at all. So I think the seasonal vaccine is very important because right now there are various kind of diseases that
Diseases.
Yes.
are flying everywhere.
Mhm.
So if we can protect and prevent ourselves from some of them, or more than 50% of them, the rest is also risky. But we protect a lot of percentage that will enter our body. I think that's a good idea if we
Right.
can do that.
And one, if you like you inject with that kind of viral or bacteria that you have the immunity before,
Mm-hmm.
it will can be reduced the longer of hospital stay for you. So
Ah,
it means to reduce the cost, and you will get care
ah,
better than who never get the vaccine before. This is
okay.
better if
That
you
means
get
still
the
have chance
immunity.
to get sick, but or for example, if I don't get the vaccination at all, I may have to be over a week in the hospital from
Right.
that kind of sickness.
Yes.
But
Yes.
if I got the vaccine, I may stay in a shorter period and save a lot of money.
A
You
lot.
can save a lot of
I mean,
money.
even a day in the hospital, it's much more expensive than the vaccination. One dose is less than 1,000 baht, but one night
Right.
is over.
Over 1,000.
Oh, it's depend on the
Many.
sickness. Okay.
Yes.
Yes.
Yeah, and we will have many questions about the influenza vaccine. That why we need to inject every year,
Mm-hmm.
as is the strain inside the vaccine. It
Mm-hmm.
had been changed every year as it is virus. It had developed itself to be a little bit stronger or a little bit weaker. So that's why we need to inject every year. And
Mm-hmm.
I will tell you the latest strain of the influenza vaccine of our hospital right now. They are composed of four strains inside the vaccine, which is consists of Brisbane, South Australia, Victoria, and Phuket, or we call Yamagata. This is the latest strain that we have.
That sounds interesting.
Yeah,
Phuket, but Yamagata.
Yamagata.
Okay, let's study it later.
Okay, all right. And the next vaccine that I will going to talk today is about the vaccine for prevent the respiratory disease or pneumonia.
Uh-huh.
This is the vaccine for prevent against the pneumococcal infections. And actually, we have the two brand available in our hospital, which is composed of like the 13 strains and 22 strain. So I will going to talk with the 13 strain first. This strain is indicated for the person who is about 6 weeks and older. By the dose is will for 6 weeks to 15 months. The children is need to inject their full dose of the vaccine at the schedule. By the adult, it will inject only one dose, and it will long about like 5 to 10 years
Oh,
after you get the one dose.
5 to 10 years.
Yeah, it's
Okay.
needed. If you finish 10 years already, you need to re-inject again.
Okay.
And for the 23 strains of the vaccine, this is indicated to the person who is 2 years and older with the certain health condition like have the heart condition, have the diabetes, or smoke the cigarette, or have the like the high cholesterol in the body. The schedule to be injected, you need to inject like the 13 stain first and wait for about 8 weeks and inject the 23 stain again to get the best immunity in your
Don't
body.
worry, you don't have to decide that by yourself. Once when you have the questions, you also can call us at 1719 and ask them to connect you to the pharmacist. But I have to say, by experience, some medication you cannot go directly to our pharmacy and buy it. You should see the expert first,
Yes.
which is related to your sickness, and get maybe some investigation or some tests done before changing the dose or give more or less or take more or less medicine.
Yes, of course.
Yes.
It sounds like, oh, there are many things to do with the medicine, but it's not that complicated. Just ask the
Just
expert.
ask.
They are
can
ready to
answer for
answer your
you.
question.
Right. And the last but not least is vaccines about prevent the dengue viral infections. This is a vaccine that indicated to the person who is about 9 to 45 years old, to the person who already like exposed to the dengue infection before. Because from the data nowadays, it's showing that it's from the research. If the person is never inject with the dengue infection before and get the vaccination of the dengue, maybe the symptom may be getting worse.
Okay.
The data is come from the paper on the latest year.
Okay.
Yeah. So if you later have been exposed or ever inject with the dengue viral infection before, the dengue vaccination is the one choice for you for protect you from the another dengue
So
infection.
you mentioned about 45 years old too. If I'm 51 and never have dengue fever, I don't have to think about it.
Actually, if according to the research that they show, they saying that if you more than like 45 years old, the chance to be injected with the dengue vaccine is reduced. Yeah. So if you in this age, yeah, it would be better for you to get the vaccine.
Okay, so for those who are under 45 and you have got dengue fever once already in your lifetime,
Right.
so come and get the vaccination.
If you come get, you will get like about 3 doses of the vaccine as
Okay.
scheduled.
Okay.
Yeah, and if you're not sure that your health condition or the condition that you have right now is have the vaccine to prevent or not, you can let it just ask again that is have the vaccine for prevent or not, because some health condition or some disease if you don't have the vaccine for prevent, like chikungunya viral infections or Zika viral infection, it don't have the vaccine for prevent it.
Okay. So besides that, there are many questions that friends of mine also ask about. They feel like they're allergic to medicine, but they cannot identify themselves. Should they also give you information when they come into the hospital that their condition is after take this kind of medication, they have something happen with their body which is abnormal. So do they have to inform the pharmacist or the nurse at the station?
Actually, they need to inform to the nurse, pharmacist, or doctor, every health professional to tell that you're allergic to that one. But not for all people will like allergic to the medicines or certain foods, some kind like that. Maybe you have just have like a side effect from the medications. We have the two things that you need to like the concerns about like the allergies and like the side effect.
Mm-hmm.
The allergy is a situation that we are like unpredictable, that we will allergy to this kind of medications or this kind of food or herbal or not.
Mm-hmm.
But if you have the symptom, right, the rash around your body, you're feeling itchy, you get eyes swollen, mouth swollen, or include like the difficult breathing.
Yes.
This is a symptom of allergy. You need to stop that kind that you take and come to the nearest hospital immediately.
Should they take a lot of water, for example, to reduce the chemical in the body, or the first aids for themselves before? Maybe it's take them like 15-20 minutes to reach their nearest, not our hospital, not necessary to come here if you are living very far away, but the nearest assistant like clinic or hospital. What should they do during the time that they feel, oh, this may be allergy? What should they do?
Actually, they would take the antihistamine.
So you have to have antihistamine
Yes.
at home.
Antihistamine, like
Can they get from the pharmacy?
yes, of
Yes.
course, they can
Okay.
get to the pharmacy nearby for antihistamine.
Okay, that means
And
before rushing to
to the
the
hospital.
clinic or the hospital,
Mhm.
stop over and get antihistamine if you don't have it at home.
Yes, just
Okay.
take like one pill of antihistamine and then quickly or fastly go to the hospital.
I feel like if I take something like that, I may feel also sleepy.
Some of it
Yeah, a little
could be
bit.
You
sleepy.
should have a driver.
Yeah. Yes, of
But
course.
some of them
Yes,
not
of course.
sleepy.
Yeah, okay. And yeah.
And like drinking a lot of water is, if you not help about to reduce the symptom of allergy, the
Ah,
antihistamine is more better. But if you don't have, you need to come to the quickly to the
okay.
hospital.
Call 1719
To
or
get the
call
ambulance.
or 1669.
1669.
Right.
Okay, they will send you the nearest ambulance.
Yeah, and also the another term is about the side effect. This is the side effect is predictable, that we know that every medications that have the side effect of, for example, of like the nausea, vomitings, or the diarrhea. But you no need to worry. If you get the medicine from the pharmacist, they will tell you each medicine have the side effect from the medication or not.
Yeah.
And they will tell you the side effect and how to prevent the side effect for you. Yeah, so not every
Is there
person.
a medication to give to protect the side effect?
Yes.
Yeah.
Something like that?
Sometimes if the doctors thought that it would be necessary, so they will give the medicine to prevent
To
it.
prevent.
It's
To
just
prevent
like
the
before
side effect.
vaccination, you may get a paracetamol because
Yeah.
you
Or
are
reduce fever.
Feel pain or
okay,
fever.
kind of. I think it's really important to see the pharmacist or talk to pharmacists because friends of mine, as I said, we're I'm old lady, so my friends are also about my age and or older, even older, and they are living on this island. But some said, I normally go back to my home country and I travel back to Phuket with a spare
Of medicine.
of medicine. Yeah, that is good for almost half a year, but now they cannot fly back to their home country. So if they have that kind of problem, they can also come to our hospital. We have all kind of medication that are ready to give to those friends.
So if your medicine is going to like running out or nearly to running out, so you may call 1719 to ask first whether we have your medicine or not. But if in case of we don't have the same kind of your medicine,
Same brand.
yeah,
you
the
mean?
same brand or the same ingredients of the medicine, but we have the doctor and the specialist doctor to adjust the medicine for you. But firstly, you have to meet a doctor. You meet a doctor first.
I think so because some condition maybe need to be checked.
Yes,
As
of
we
course.
mentioned before, before taking
medicine.
medicine, maybe you need less medicine after the check. Okay.
Yes.
So and I mean, but if I have a lot of medicine at home, how should I take care of them? Because some said you have to put in the refrigerator because it's different temperature. You come from Europe. In Europe, it's cooler than here in Phuket, especially Phuket, hot like.
So
Very
hot,
hot.
right?
Yeah. So
Very
how should they live or pack their or store their medicine?
Actually, it just depend on the kind of medicine or
Mm-hmm.
depend on the medicine. But two things that you need to focus on is the heat and the sunlight and the moisture. These two are very dangerous to destroy the medicine. If the medicine is said that to keep it in a room temperature, so it means like 25 degrees Celsius would be okay for that kind of
But
medicine.
our room temperature
Like
is
30, like 30
30
or
plus.
35, 30 plus,
Find
yes.
find a corner in your place which is
And keep it.
not too hot,
Not too hot.
not reach the sunshine, but not moist.
Not moist, yes, of
Yeah,
course.
okay.
But if it said that you need to keep the medicine in the refrigerator, so you just keep in the fridge, not at the door size or not in the freezer,
Mm-hmm.
because the suitable temperature would be 2 to 8 degrees Celsius, which is in the middle part of the refrigerator.
Okay.
Mm-hmm.
So not in the fridge, not at the
Not,
door side. The door side is maybe just for a
yes,
bottle of drinking water,
yes.
kind of. Uh-huh.
But if you get the medicine that need to keep in the refrigerator from our hospital, we will have the ice pack for you, like during your way home, so you can keep it in the cool temperature all the time.
Ah, that's great. Because if we suggest our customer, our patients to take them in a good place, cool place, you mean, but on the way, maybe they have to
Yes.
stop over, talk to someone, it may spend an hours or a long drive home. So you also take care of the temperature
We give the
for
ice
them.
pack for them.
Okay, so that is the difference. I think many people ask me. Sometimes the packaging is similar or almost the same or the same, but how we take care of our medicine here in this hospital, how we storage our medicine, I think that keep the condition or the value of the medicine, which is written on the package. But if we put them outside or we transfer them in the wrong way, maybe the condition is not, the quality is not the same, right?
Yes, it's not good.
So as I see in their working space, it's very cold.
Yes,
Very cold.
25 degrees Celsius.
I don't want to step in. I don't want 25 degree or cooler, right?
Yes.
So I don't want to
25.
step in. When I talk to them, I call them first and ask them to come out and talk to me.
Because like for pharmacy department, we need to to store many medicine inside. That's why we need to in the cool paste.
Yes.
Kind like that.
You are fresh always too. Okay, so if we call the hospital 1719 and ask for pharmacies, are you standby 24 hours?
Yes. Our department open 24 hours.
You can call
Okay,
us anytime
anytime, but ask about medicine.
Yes, of course.
about the
Okay,
medicine.
and during the daytime, for those who don't speak English, we also have translator. If you have kind of questions and you want to communicate with us, you also can send us an email, or if you call us and ask for interpreter or translator, and those translator will collect information and call or contact our pharmacies and get the answer and get back to you. Okay? Oh, there are many possible ways to communicate with us. We are our Facebook page that we create in English version, and we also have our website World Wide Web, PhuketHospital.com, and also we have Line, yes, that you can add and be our friends. Coming soon, we will also have details of those business friends who are our, if you are a member and you present the expat card, you also can get, of course, the first thing is discount on medicine. Yes, 15% discounts for those who are living on this island and about like 65 years of age. Some of them may already don't have any insurance and they have to pay by themselves. So we think about this and we also offer this card for those who are our customer who are expat living here or longer than 3 months. Please just inform our station at the receptionist at the reception, and they will communicate with us and we will put you in the system as our expat member and you will get discount for medicine. Besides that, let me also share with you, because right now in our hospital, dealing this difficult time that we are facing with COVID-19, we also have many options that offer to the expat who are living on this island or the nearby province. for example, for some procedure that need to be done, you suffer from your pain, your sickness, but then um, you're worried about expenses, please get back to your department and contact our staff and consult. If some operation need to be done during this period, we offer you discount. I have to say that because we know that many people are facing also economic system that everywhere, not only Thai, also the foreigner who are living here. And beside that, we also have some package. I think it's also related to the pharmacies for those who need to travel. And if you need to go somewhere, you can also come and do the check. Yeah, maybe they ask you at the station, check before travel, check before going to work. Because right now, if you go without the medical certificate, it's difficult. You should have more than your passport, your flight ticket. Besides that, you need a medical certificate before flying. So the information is like this. If you need to fly somewhere within 3 days, for example, if your flight is on Friday or Saturday, you can come and get this medical certificate by get the test done, and after that get medical certificate that lasts for 3 days. You have to fly with that medical certificate within 3 days. If you change your schedule, sorry, you need a new one. Yes. There are many campaigns, so just contact us. Okay, so on your side, have you got any special suggestion for the expat who are living on this island? Let's see again, what should they do and manage for those who has NCD diseases? Okay, like, or I can say like, am I right or not? I have to comply.
Comply, of course.
Yes, and every day, as doctor suggests, or as every second day, it depends
It depends on the medicine.
how the
That you
design.
check.
Yes, and if I have many different diseases, uh, should I consult someone which before, which after?
So normally, if you have a lot of medicine or many kind of
I
medicine,
have a lot of friends who have a condominium
of
of medicine. Yes, this drawer is for Monday, Tuesday, Wednesday.
Yes, I have seen that a lot. A lot of foreigner got that.
Yes.
First, we check the interactions of our medicine for you before we dispense the medicine. Every time we check that, whether to confirm that there is no interactions of it. But on the label, you see that. But sometimes it said before meal, after meal, or after meal immediately.
Yeah. And for someone who eat all days, we have to
4 times
ask
per
you.
day, right?
I eat more than 4 times per day. When should I take my medicine?
Because this is related to the action of the medicine. If we say that before meal, it means that 30 minutes before meal, because the medicine needs emptying stomach. Okay. If you forget before meal, so you can take like 2 hours after meal to confirm that your stomach is emptying, so that you can take the medicine. But if on the label we say that after meal immediately, it means that sometimes the medicine might irritate your stomach.
Okay.
So if you finish the food, so just take the medicine. Okay.
Okay.
And to confirm that you take it correctly, so you just read on the label every time you take the medicine.
And before bed.
Before bedtime is just before going to bed, like 3, 9 p.m., 8 p.m. Because sometimes the medicine acts very well at nighttime. So that's why you take at
How long we have
bedtime.
to sleep with that before bedtime medicine? If I sleep only a couple hours, is that working?
Yes,
Yes,
it's working.
Just nighttime.
Yes, just
30
nighttime.
minutes before nighttime.
I'm sorry, I'm not a good patient. I have so many crazy questions. And one question I really want to know, for those group of people who eat only once a day, eat only twice a day, and you said 3 times before meal or after meal, how should they manage? Or they should take something or eat something, right?
It depends on the medicine, I would say that. But sometimes if the medicine not said anything, or if it not said that after meal immediately, so you just grab some bread and take the medicine, or you just take the medicine.
I think if you have special activity or behavior, which is different from most of the people, so that's why you have to talk directly to them.
Yes.
This medication, but I only take this and this. Okay, then consult with them directly.
Yes.
How to get back to you again? Please suggest.
You can call like us to 1719 and tell the operator that you need to contact our pharmacy to talk with them about the medications.
1719.
And ask
Okay.
for pharmacists.
Okay. Ask for pharmacies. You don't have to ask for Enfar and Earn, but they also ready. They are big team, I have to say. Before we start this topic, I get to your department, their group of people helping me a lot, and they are ready to help and assist you, of course. And I have to say thank you again today that you're coming and give us a clear information. For those who still have questions, please write down your question and send to us. And next week, I have to say, very interesting again about weight management, and there are more detail, and we're gonna talk with sports scientists. Okay, so next week, maybe you also can watch our program.
Yes,
2 o'clock on Thursday, always see you again. Health Dialogue by BDMS. Thank you for today. Thank you and goodbye. Have a good day.